Hello. Just waiting on some folks to hop on. We'll get started. Okay, so we're about to 100 folks right now, so we'll go ahead and get started. Again, this will be viewable after this is over on our timeline. So just kind of want to give an update on numbers. We're still at 22. So that means we haven't had a case reported since this past weekend, which is good news, but also just want to encourage you to be cautiously optimistic. We know that people are still being tested and we have pending tests, so just encouraging you to be cautiously optimistic. Missouri cases are still increasing, and so we need to keep that in mind as well. I do have some more good news. We have 16 folks that have been released from isolation and are right now being considered recovered. So 16 out of the 22, and then we have one that resulted in death, unfortunately. But yes, 16 people have been released from isolation. So that means that there's 7 days past symptom onset, and then 3 days of symptom recovery, and so that's great news. A couple of things that came through through the Facebook or website kind of after last live are some questions I want to talk about. Can young people be infected with the coronavirus? I think that's been talked about a lot, but certainly everyone can be infected with coronavirus. Now, generally, young people are more likely to have more of a mild illness, but everyone can be infected with coronavirus. So we all need to take the precautions that are being set forth by the White House Coronavirus Task Force and the CDC. So that's important to know. I wanted to dive a little bit deeper on antibody tests because we've been asked a lot about antibody tests. So because of the pandemic and the state of the emergency, the FDA has waivers for these tests to increase testing capacity. So what I would like to say on antibody tests is that none of these have been validated by the FDA. And that's something that Dr. Fauci has talked about. And so we need to be really careful about the antibody test and what their validity is and if they are reliable or not. It's also another thing to think about is that even if somebody tests positive for an antibody to coronavirus, we don't know that antibody necessarily means that they're immune, and we don't know for how long they're immune. So we don't have a level of antibody to know, does that mean that this person is immune for this amount of time? So there's not enough data yet to decide whether or not that means that they're immune and can go back out into society, because I know that's been the real question is, if we know if somebody's immune to this, does that mean that, those people are allowed to, not follow the stay-at-home orders or continue their normal lives as what, we had before? And there's just not enough information on that yet. I want to talk a little bit about the stay-at-home order because I know that there's increasing confusion around the innovation clause that is under Article 4 of the St. Francis County stay-at-home order. So remember that the statewide order went into place on April the 6th. The statewide order has very explicit instructions about non-essential business, and those are the same things that we're using under that innovation clause. So social distancing. Social distancing means that people in non-essential businesses have to be 6 foot away at all times, unless they are household members. So social distancing is the big one. Also gatherings. So we can't have gatherings over 10. And then there's some extra information in the statewide order about the size of a facility and that type of thing. And then hygienic practices. So we want to see, hand sanitizer, regular hand washing, all the things that we're asking the public to do. So there's stipulations to the operation of non-essential business. And so the innovation clause, no variance will be allowed unless a business non-essential business that is not exempt, they have to be able to meet those criteria in order to operate. And that's under the statewide order. So that's being enforced in every jurisdiction in the state of Missouri. Now, counties can make ordinances or rules that are more strict than the state, but they cannot be more loose than the state or more allowing than the state. On our website, sfchc.org, you can go to COVID updates and you can go to the direct link to every order for the state, the guidance from the state, our order locally, and guidance, just general guidance for different sectors. And so I would encourage you to take a look at that. Testing. So, and I already have seen a couple things roll through about testing, and I saw a lot of comments about that in the last live, and so I wanted to again take another kind of deeper dive into that. We've reached out to all of our local providers that we know are testing to kind of talk with them and find out what kind of criteria are you using. It sounds like most of them are, they're all using the CDC criteria. And so that's good. But I want to remind you that CDC criteria also includes priority levels. And shuffling my papers here because I have the paper that we use. I won't show it because I know it's mirrored and so it won't show up well, but you can view this on cdc.gov. But so their priority number 1 is going to be hospitalized patients. And healthcare workers that have symptoms, because healthcare workers can serve as vectors. So what a vector means is that person can spread the illness to other people, and especially if you're a healthcare worker and you're taking care of people and probably people that are at high risk, we want to identify cases in health workers. That's important. And then priority number 2, patients in long-term care facilities, patients 65 years or older, all of these people are with symptoms, patients with underlying health conditions, and first responders with symptoms. So that's priority number 2 level. And then there's a third priority level that talks about critical infrastructure workers, individuals who don't meet any of the other criteria that have symptoms, that type of thing. So those people all fall into that third category. I'll show it, but I know it's mirrored, but this is on cdc.gov's website. So, testing in general is an issue throughout the entire state. I've heard from other administrators of health departments, and we know that there's some type of gap between who is getting tested and who is not getting tested. There's a couple of things to think about here. So we currently have one person that is hospitalized out of all of our cases. And so that's a good thing in that, we're not seeing this huge jump in the demand to the healthcare system. So I want you to take that as a positive thing, but also know that we all have to be monitoring for these symptoms, and we have to, seek the guidance of our medical professionals, our healthcare workers and doctors, to be evaluated for the need to test. There's also a symptom checker on cdc.gov that I've kind of played with just to see how it works, and so you can use that too as some help. But we really want to encourage, if people are having severe symptoms, so I'm talking about, shortness of breath, blue lips, heaviness in the chest, you need to seek medical care immediately. We ask that you call ahead before you're seeking that care to give them a heads up on what your symptoms are so that they can properly care for you. But, I think testing is an issue throughout the state. I had a lot of questions about if you don't have a healthcare provider, how can you get tested? We do have the Parkland Urgent Care that tests. Again, we ask that you call ahead, and again, they're going to do a clinical evaluation to decide if it's appropriate to test. And then Midwest Convenient Care, we spoke with them, and those patients are being referred to Midwest Health Group. So you really need to call ahead to your healthcare provider, which is what we're asking people to do anyway, and talk with them about what their testing capacity is. You can tell them what your symptoms are and see if there's a need, through their clinical judgment, to test. So that's just some important things to know about testing. But I hope that we're going to see testing capacity continue to increase. But they do have, criteria for priority level for testing. And keep in mind too that most cases recover at home. And the tough thing is that without notification of or identification of cases, and this is kind of the discussion between us and healthcare providers and the state, without that knowing of confirmed cases, we can't, as the health department, identify and isolate and quarantine people appropriately. Because how it works right now is when we get a positive, we do that contact tracing, and those close contacts are quarantined for 14 days. And some of our cases, when you see the number that are contacts, those are contacts to confirmed cases, and a lot of those are connected. And so that gives us a chance to separate the sick people from the healthy people. And so that's a tough thing in the realm of testing, and why one of the other reasons why testing is very important. Okay, I'm going to try to back up here and hit some of these questions. Has BJC Farmington, have they ever been at risk for being overwhelmed since the crisis has began? They've kind of had some upticks here and there. I don't want to talk on behalf of BJC, but they've had some upticks here and there, but nothing like some of the things that we've seen in the news in other places in the country, certainly. But they have had some upticks here and there, and currently they're doing well and have enough capacity, but staying on guard and understanding that could change. Have county executives been making any plans to reopen? So again, I just kind of want to reiterate that the statewide order is still in place. So we still have to follow the statewide regulations that have been put in place. The St. Francis County order and the state order are very paralleled. Really, the clause about non-essential business and our innovation clause are very strikingly similar, because that innovation clause is only going to be allowed if those people can meet the requirements of non-essential business under the state order. And keep in mind, our order was enacted on, it went into place on April 3rd, so kind of a couple days ahead of the state. But we have been talking about what maybe a soft opening looks like, but all of that is going to have to be in accordance with the state orders. We haven't heard anything solid yet about what's going to happen with the state order, if that's going to be extended. But there's talks across the country and other places who have done very stringent orders about how they're going to do soft openings, because we probably will see an uptick when life goes back to normal, or somewhat normal. We probably will see an increase in cases, but we don't want to see again, this huge surge of cases. So it might look something more like what we've talked about as a soft opening, whether that's continuing to limit the amount of people or taking other measures in those businesses that have not been able to be open because of the non-essential clause in the statewide order. But there are discussions around that. I see a question about closed captioning. So I don't think it's actually available on the live. It has to be when it's posted, we have to go in and turn the closed captioning on. So, but then I see somebody saying they automatically showed up. So I don't know. Live is interesting. There's a question about nursing home cases. We do not have any cases associated with nursing homes at this time, which is great. We've talked to all of our nursing homes. We touched base with them last week and talked about their plans and kind of where they're at and how they're feeling, and talked about PPE and resources to get PPE. They're still obviously on lockdown and not allowing visitors in. And so it's a good measure in helping keep our nursing home population safe, but we do not have any cases associated with nursing homes at this time, which is great news. I see a lot of people giving some information about closed captioning. Thank you for helping us out on that. Trying to scroll through here. I may have hit all of them. With 16 now recovered, how many active cases are in each city? especially Farmington, which has the highest number of cases. So I want you to be really careful on zip code level data because there's 66,000 people in the county. And so we're what's considered a mid-level county. But the zip code level data, I think it can give some false sense of we're okay to, end social distancing and that type of thing. And we need to be really, really careful with that. I don't have those numbers right off the top of my head of who's in which, I don't know how many are recovered from which zip codes right off the top of my head, but 16 are recovered. So that means that 16 are recovered, 1 is deceased out of the 22. So we have 5 active cases. And so again, I want to caution you on the zip code level data because we all need to be taking the appropriate precautions regardless of where these cases are located in the county. So. Too many different stories on this stuff. Who do you really believe? Too much confusion, to be honest. So, I agree. There's a lot of different information out there. I've talked about it before, but we really need to seek information from reliable and credible sources. Dr. Fauci has talked about this as well. There's lots of rumors out there. There's a rumor that the 5G towers affect your immune system, and Dr. Fauci has spoke to that, and that's just not true. So I would encourage you to use cdc.gov, other resources to that caliber for your information, because there's lots of false information out there. So I would encourage you to use those reputable resources. Do you think kids will be back in August? I hope so. I don't think there's a good answer to that question at this time. So I think that's something that remains to be seen. Now, I know there's some discussions about New York and other places like that, but we need to keep in mind that we're not seeing what New York has seen or is seeing right now. That doesn't mean that we won't in the future, that things could shift. But I think at this time, I am hopeful that kids will be able to go back, for the next school season or school year. Somebody was asking about the local capacity of the hospital, and again, I kind of spoke to that earlier. We all need to be prepared for the fact that we could be infected, which is the reason for these stay-at-home orders. Also, the fact that asymptomatic patients can transmit this and have no idea that they're sick, unknowingly transmitting. So all of us need to be diligent in watching for those signs and symptoms, especially fever, cough, shortness of breath, certainly. I know that some of our healthcare providers have also added the lack of taste and smell to their criteria. That's not something that has been put forth by the CDC, but that's something that they've wanted to do, which certainly they're able to do that. So we all have to be diligent in watching for those symptoms and following these guidelines, every one of us, to be able to prevent or really slow the spread of disease, which is really what we're trying to do at this time. I'm going to try to take just a couple more questions, and then I really need to hop off here. Are we likely going to extend the stay-at-home order? I kind of talked about that earlier, but the St. Francis County order says until further notice. The state's order is up on the 24th, but I know that they're reevaluating that. I haven't heard anything solid on that either. So I'm going to hop off here. We'll follow up on the questions. We've also added questions to our frequently asked questions on our website, so please check those out, because a lot of those are kind of repeat questions that we've answered and might help you. And then the CDC also has frequently asked questions that you can look to for a lot of the answers. But what I would encourage you is that if you are sick, you have symptoms of COVID-19, fever, cough, shortness of breath, you need to reach out to your healthcare provider to be evaluated to see if you qualify or meet criteria for a test, or if they feel that you need to be tested. Over 250 people that live in St. Francis County have been tested at this time, and 22 have been positive. So around 10%. And that's really what the state is seeing too, for positives to negatives or people being tested. So it's important that your healthcare provider evaluate you, and if they think you need to be tested, then they will test you. And that's really, again, on their clinical judgment. And, things are changing all the time, and I know that's frustrating. But this is a new virus, and as we learn more things about it, and as we have more data to make good clinical decisions, we're going to see changes in the way that we respond to this illness. So appreciate you being on. Thank you all for taking the time in your day to hop on and listen, and then also for following the guidelines and doing the things that have been asked to protect our most vulnerable and prevent this infection and slow the spread of the infection. So we'll follow up with some answers to these questions on our frequently asked questions by the end of tomorrow. So thank you so much. Bye.